Please, you can start.
Obrigado. Good morning to all. Thank you for choosing this session. My name is Ashofteh, and I'm here to present a paper entitled A Novel Layered Learning Approach for Forecasting Respiratory Disease Excess Mortality During the COVID-19 Pandemic. This is a joint paper with Professor George Brav and Professor Mercedes Ayuso. Okay, this presentation is structured as follows. First of all, I'd like to give you an overview of this research and motivation. Next, I'll focus on the materials and methods, empirical results, and then we'll consider discussion and conclusion. My first point concerns excess mortality. Excess mortality refers to the number of deaths from all causes during a crisis, above and beyond what we would have expected to see under normal conditions. And it is a critical input in many research and policy areas in epidemiology and public health. Empirical studies in multiple areas show that it is hard if exists, to find a single widely accepted forecasting method that performs consistently well across all data sets and time horizons. Different selection methods, different fitting periods, alternative accuracy measures, structural breaks in data generating process, and misspecification problems. They all can lead to different model choices and time series forecasted. For mortality rate also, there is no general forecasting method applicable to all situations, and this crucial quantity cannot be known but can be estimated in several ways. In the case of COVID-19 pandemic, we are interested in how the number of deaths is increased in compared to the deaths we would have expected if the pandemic not occurred. So what we propose in this paper, ensemble learning strategy in a layered learning approach is recommended in this research to solve the predictive tasks with improved predictive performance and take advantage of multiple learning process into an ensemble model. We adopt a layered learning approach to an ensemble learning strategy to solve the predictive tasks with improved predictive performance and take advantage of multiple learning process into an ensemble model. In this proposed strategy, we built each model with a specific holdout and make the ensemble model of time series with a dynamic selection approach. For the experimental section, we studied more than 12,000 observations in a portfolio of 61 time series of reported respiratory disease deaths to show the amount of improvement in predictive performance of excess mortality. Then we compare the forecasting outcomes of our model with the corresponding total deaths of COVID-19 for selected countries. The layered learning approach in time series consists of breaking a forecasting problem down into simpler subtasks in several layers. Each layer addresses a different predictive task, and the output of one layer could be used as the input of the next layer. Here, as we can see in this figure, the task of the second layer is finding the best holdout for each individual panel members and for each time series algorithm. The third layer is for selecting the best model with their specific holdout. And finally, the last layer combines the models to an ensemble model. We use the symmetric mean absolute percentage error, SMAPE, as forecasting accuracy measure. We first tried the set of holdouts from 1 to 10, and then according to the results, we selected 3, 5, and 7 years as the representative holdouts. The best forecasters model posterior probability, I mean the model weights, are computed using the softmax function. The softmax function is a generalization of the logistic function often used in classification and forecasting exercises using traditional machine learning and deep learning methods as a combiner or an activation function. The pseudocode of the proposed methodology is shown here with the primary items of our study. The time series of countries mostly started from 2000 to 2016, and our target year was 2020. The accuracy measure and the list of models are presented in this slide. The characteristics of these candidate learning algorithms here and time series methods are presented more in detail in the paper in section 2.2. The dataset was from WHO, includes the death time series of different countries for all genders. First, we distinguish the quality of data for each country according to the metadata of the dataset. We ranked the data quality of the countries as shown in first table on top of the slide. We considered only countries with data quality in the first three categories. Another table shows the codes that was classified as respiratory infections. For obtaining the total death caused by respiratory diseases, we had to aggregate either the code 380 and 410 or equivalently the codes 319, 400 and 410. The procedure provides us a data set with more than 12,000 observations in a pool of 61 panel members time series, which are countries, from 2000 to 2016. This table shows the positive effect on prediction accuracy by selecting the best holdout for each model and remove the outlier models from the ensemble. The proposed ensemble model shows a significant improvement in accuracy in comparison with the other ensembles and each individual state of arts. This table shows all models are excluded several times, and it shows that the model selection approach is an appropriate strategy. The methods are ranked based on their contribution rate in the ensemble. The vertical comparison of the results give us an insight about the contribution of the different models to the ensemble. The horizontal comparison is also useful to assess the rate of contribution across different holdout periods. This table shows a potential positive effect on the final forecasting accuracy of the ensemble model by selecting the best holdout for each individual model along with selecting the best forecaster. As we discussed in the paper, they are exactly the same of different layers that we consider in our layered learning approach. Result 3 represents the contribution ranks, exclusion frequency, and proportion of the selected models with the best holdout for each. It gives a proper explanation of the improvement in the accuracy of the ensemble by using the proposed method. This table is about computational efficiency. By looking at the average of runtime and their mean confidence intervals for the proposed method and other two approaches, we could see that they are not significantly different in computational efficiency. Even if our model is a little bit more complicated, but in the runtime efficiency they are almost similar. So this table shows the forecast for numbers of deaths caused by different kinds of respiratory diseases for 61 countries in 2020 by the proposed ensemble learning model for panel time series with model selecting a strategy and dynamic holdouts. Japan and Philippines are shown as vulnerable countries for respiratory diseases, but in COVID-19 pandemic, they have had only a low death toll. Maybe the experience of these countries with high mortality of respiratory diseases played a role in managing the pandemic better. We provided clear evidence on the competitiveness of our method in terms of predictive performance when compared to the state of arts and even the usual ensemble models with fixed holdouts for all models or without model selection layer. Japan and Philippines, as we saw, with a high number of respiratory diseases could manage the pandemic very good. They could be more recommendable for further studies on their policies and health strategies in comparison with the countries with low rate of mortality. Finally, these are selected references. If you have any question, I'm happy to answer or listen to your comments. Thank you.